in your mind, you have to compare pandemics to hurricanes. And so if you prepare for a hurricane and that Category 1 hurricane happens to miss your town, it doesn't mean that all the preparation that you did is a wonderful thing, that you saved the town because you happened to build up the levees and you had to make sure that the flood control was good. You just happened to be lucky. Next year, a Category 5 might well hit. And the fact that this one was mild doesn't mean that the next one won't be. H5N1 is still out there. We've got 500 recorded cases. The peak year was 2006, but it's still got a 60% case fatality rate. Might be the next one, just like the H1N1. It might be some other one that you don't anticipate. So all of this planning, which, by the way, got state, local, federal officials and local non-officials and bloggers all talking to each other about how to better prepare locally and at the federal level, was all a wonderful, wonderful thing. But behind it is a lot of anti-vaccine sentiment, which I think that we all just have to recognize. This was a story from the LA Times, parents uneasy about swine flu vaccine, and people tried to convince skeptical folks that the medicine is safe and effective, but you had folks arguing, well, vaccines really are kind of a crock and maybe you shouldn't be taking it. That's one of the reasons why the demand wasn't so great. So Bill Maher had his issues. This fella, Glenn Beck, had his issues. Both of them got most of their science background and information from University of Google, which is where they got their degrees. And so, I'm not a credentialist, but there's times that I think you really have to go back to reliable sources, and these folks weren't necessarily doing it. I wanted to show you this data because I thought it was really interesting. Danbury Hospital is where I practice, and I was something of a vaccine advocate. And last year, we got about 73% of the staff vaccinated for seasonal flu and about 61% for the H1N1 swine flu. And this is the interesting thing, because when you look at the statistics, whether it's hospital personnel or all healthcare personnel, look at that all healthcare personnel, 37%. That was just dreadful. Typically what happens is that healthcare people are some of the worst in actually accepting that they need to get vaccinated. And what happened is that we had an H1N1 outbreak. We didn't have a seasonal outbreak. So now we made H1N1 vaccine available. And what did people do? They said, well, I don't like this H1N1 idea. It's new, and I don't like new. So I tell you what, I'll compromise. I'll get the seasonal vaccine because it's been around and I trust it, which is, given the fact that there was no seasonal H flu around, it was kind of like saying, I know I'm drunk and I lost my car keys and I know I left it in the house, but I'm going to look under this lamp pole because that's what a light is, and it's got nothing to do with where the actual problem is. And we see that again and again. Part of it is policy. If you had a hospital that actually required you to get the vaccine, you get 87% compliance. And if you have neither suggestion nor required, it's down to 11%. So there's going to have to be a long, hard look at medical people in terms of what's required and what's not. It's got to be done right. It's got to be done in consultation with unions, and it's got to be done in consultation with the folks who are going to get the vaccine. But it is the future. And if you're going to step back and say, well, what about vaccines in general? Again, I don't want to take too much time, but this is an actual case report of the pertussis illness from 1976 to 2004 throughout the United States. We're up to about 25,000 cases in 2004, more since. You can see that spike, and that spike is related to the fact that there's been 6 infants so far who have died in California, which is a hotbed of refusing vaccines for various and sundry reasons. In fact, the county in California which is most likely to be resistant to getting vaccines is Marin County, which really isn't a question of medical access or insurance. So with that, I just want to close and say that the whole concept of vaccine is important. It saves lives. There's really good reasons to do it. You have powerful forces arguing against it. A rational discussion has to be made, but one of the points that I made to the federal government when I was speaking with them on multiple occasions is that they underestimate anti-vaccine sentiment. And finally, I want to close and say, vaccines are good, but if we can teach our kids not to do this, I think maybe the whole problem could have been averted in the first place.